I'm Neil Marshall, president of Consonus Pharmacy. Recently, we've all been on the receiving end of a lot of great news about COVID-19 vaccines. I know I don't need to tell you how important that is. In fact, I get emotional just thinking about it, and I mean that in every sense of the word. Inspired, excited, and certainly committed to the task of getting it distributed safely and quickly. Here at Consonus, we're pouring our heart and soul and all possible resources into being ready to move rapidly for you when the vaccine is available. And that's what I'm here to talk about today. Right off the top, it's important that you understand this is a very fluid situation. What I'm about to share with you is what we currently know to be true. The information is based on our daily interactions with the CDC, Operation Warp Speed officials, and industry leaders. When information changes, and I know it will, we will let you know immediately. You're already hearing a lot about vaccine status and timelines in the media, but I would suggest to you, please look to Consonus, as you always have, for absolutely trustworthy information that is specific to the senior care industry. So with that preamble, here's what I can tell you, our customers, today. Consonus is a CDC-approved provider for Phase 1. When the CDC evaluated the results of the vaccine preference surveys completed by all of you, they saw merit in including just 6 independent long-term care pharmacies in Phase 1, and Consonus is one of those 6. We helped advocate for that position by demonstrating how our established partnerships with all of you would help us work together to move quickly and in a manner that respects the complexities inherent in caring for seniors in congregate settings. So that's the good news, but we're also dealing with an unexpected curveball. Operation Warp Speed recently made a late-stage adjustment and granted state health authorities a stronger role in vaccine distribution decisions. That change has introduced confusion for facilities and pharmacies. Now each state must formally include Consonus in their plan and allow us to distribute in their state. As of today, Oregon and Nevada have included us in their plans, and we're working around the clock to be formally added in other states. At this moment, if you're in Oregon or Nevada and selected Consonus as your vaccine provider, we're all set. If you're in other states and selected Consonus as your provider, you may be hearing from either state health officials or one of the national retailers to provide your vaccine. I would recommend that you set an appointment with them to support you, and I would ask that you let us know that you've been contacted. We will inform you as soon as your state permits us to supply vaccine, and you may be able to switch to Consonus if it's advantageous to do so. Like all of you, I'm trying every day to pin down an answer to the biggest question, which is, okay, so when do we start? What day will that first vaccine be administered in my facility or community? While unfortunately we still don't have a specific answer, I'll do the best I can to outline the factors to consider. Both the Pfizer and Moderna vaccines are on track for emergency use authorization by mid-December. Specifically, the FDA review of the Pfizer vaccine is scheduled for December 10th, and approval could follow within a week. And we've probably all seen General Perna, the leader of Operation Warp Speed, on the news saying the product will be available within 48 hours after authorization. What that means for Consonus is that we're preparing for the vaccine to be available to us in Oregon and Nevada by December 15th. But we know that there are many variables that will influence this timeline. So we anticipate that it could be the end of December or even early January before our trucks are rolling. As you and other providers know all too well, one of the biggest challenges with the pandemic has been sometimes conflicting guidance from CMS, states, and county health departments, and it's possible the vaccine rollout could suffer from some of that same disruption. So in the meantime, what are we doing to get ready, and what should you expect? Consonus has made investments in software, cold storage, transportation, and a host of capabilities required to deliver vaccines safely and efficiently. We've devoted significant resources to this so that when we get the green light, we're ready to move quickly. We have an elite project team with deep experience working on this from every angle, every day. Let me introduce you to the players. Here's Terry Fagan, our Director of Clinical Consulting and one of the best geriatric certified pharmacists in the country. She's staying on top of vaccine clinical data, and she'll be sharing some of that with you in our next video. This is Corey Hewitt, our Director of Pharmacy Services. He brings a wealth of operational, clinical, and logistics expertise to the table and is our Operation Warp Speed Program Manager. Dan Hockett is our Central Services Director, now doubling as our logistics lead for vaccine distribution. He combines extensive knowledge of facility operations with analytical skills to do all of our route planning and clinic scheduling. John Baker is our Chief Technology Officer. He and his team have developed a clinic management software solution to streamline workflows and satisfy the extensive reporting requirements. His counterpart, Liana Chen, our Director of Clinical Informatics, is doing all the legwork required to report vaccine data to state and federal jurisdictions. Beth Biggs, our VP of Client Care, and Melissa Chase, our Director of Nurse Consulting, are working with our clinical teams to design facility-friendly clinic workflows. And finally, our CEO, Phil Fogg, is engaged on a daily basis to make sure we have all the resources that we need. Without question, these are some of the best, most qualified people in the entire country to be working on this, and they're the reason I can say with such confidence that you can absolutely count on Consonus. So, stay tuned, and in the days ahead, you can expect frequent updates whenever the situation changes and as conjecture becomes fact. We'll also be providing a series of follow-up videos that go deep into the specifics. As always, thank you for your confidence and trust in Consonus. There's nothing more meaningful or important to us over the next few months than working together to bring this life-saving vaccine to your residents and staff as quickly and safely as possible. Thank you.